We went through training for all of our staff to make sure that they're prepared for this. We made sure that we had rooms set aside, they're negative pressure rooms and isolation rooms, to be able to accommodate patients that come here. And just generally making sure the place is clean, making sure everybody knows their roles, and making sure that we're prepared. We are continuing to advocate easier tests so we can get the test done quicker and more efficiently and in a faster way, whether that means expanding Tampa's capabilities or bringing testing abilities to here. Also trying to make sure we have the ability to get tests ordered quicker than that maybe somebody's having to wait here for 2 days before we can get a test done. We didn't set out to be a leader in this, but we found ourselves in that world, and so we find ourselves working very closely with the state government and with the CDC to try to inform policy, create policy, and move things faster. I think we've kind of found ourselves in a leadership role because I think it's evolving very quickly. We prepare for the worst and hope for the best. And so we are set up right now. If one of these patients comes back positive, we've already have them in isolation. We already have the staff prepared and trained working on those patients right now, and we're ready for it. We hope it doesn't happen, but we are set up and ready to where our staff is safe, the community's safe, and we can contain the outbreak as much as we possibly can.
The medical staff and the employees here at the hospital have been outstanding. We've been preparing for this for over a month. We've had weekly meetings. We have a task force that meets regularly. Everybody has been outstanding. Now that it's a reality, we're meeting daily. We're actually meeting multiple times a day. We have a command center that's meeting every 4 hours. The unique part about it is usually when you see an infection or potential for infection, everybody runs away. Our medical staff and our employees have actually stepped up to the plate and actually offered to take care of these patients and help these patients. They want to help the community. I'm very, very comfortable that we're taking all the precautions that we can take from the time they enter the hospital. If they qualify for testing, they're immediately placed into a separate area. They're immediately placed in isolation rooms, and we're limiting visitors to that room to prevent cross-contamination. So we feel they're very safe in the hospital. Business is as usual as far as the hospital goes. We have regular surgeries every day. We have all the precautionary measures in place. The patients that are at risk for COVID-19 are placed in an isolation room. Everything is separate. We've stepped up any extra precautions to protect them. So all our regular procedures are happening simultaneously with our precautionary measures for the COVID-19. They're just completely separate processes. I'm comfortable with the fact that if we get a positive result, it will be in a patient that's isolated and it won't make a difference. We're preparing for a positive patient. We're ecstatic that we don't have a positive patient. Dr. Gordillo is on self-quarantine because he's not sick. He's healthy. It's a precautionary measure since he was exposed. But he is healthy. He's as healthy as he can be. I spoke to him this morning, and he is not sick. It's just a precaution.